the groups themselves. And these studies suggest that the Hispanic population were more overweight than the black population, which was more overweight than the white population, which was more overweight than the Asian population.
Right. That's a breakdown to show us in an ethnic area situation where the problem really lies.
Well, it shows you where it stems all the way down to the elementary level.
But it's all the way through. Even the Asians are becoming overweight now. So this is a situation, even though the numbers are low, this obesity is going straight through all the ethnics, okay?
Right.
Now, the American Diabetes Association in 2004 said New York ranked number 21 for the most overweight cities in America. So we're 21 and going up.
That's right.
Yeah, and that's something that we have to do. And to deal with it, we're going to deal with some issues that come up with obesity, because there are many complications in dealing with obesity. It's not just all the fat, that you eat and all the calories and all that. There are other things involved, and I want to deal with one of those areas, and that is heart failure.
Right.
How does that relate?
Well, I'm going to go over heart failure is what we call congestive heart failure, and that is when the heart is a pump, and that's when the heart fails. And it's not able to pump, and that's why we call it congestive heart failure. Well, how does that relate? It relates to coronary artery disease, and we covered this in a topic several months back, where you have increased plaque formation from the fat, the floating fat in the body. What it does is it takes the arteries, the diameter of arteries decreases, they become smaller, you have increased pressure, the heart starts to work harder, then you have back pressure building up, the heart starts to grow, it gets larger and larger because it is a muscle, but then the heart starts to fail because we have specific laws that govern the physiology of the body, and once the heart becomes too large, it doesn't pump harder, it starts to pump less, and that's when we develop heart failure.
So this goes back to all of our programs where we talk about being proactive, okay? And the proactive situations to come in and do what?
Every single presentation we give, every TV program.
It's proactive.
Proactive, and what we need is a thorough history and physical. We need to do lab works. We need to make sure that we get a good baseline to make sure there's no subclinical pathology that is causing disease.
Such as diabetes.
Diabetes, that's correct.
And then we have others, high cholesterol. How do these relate? And I'm going to put the last one in essence of time, is this high blood pressure.
Right, high blood pressure, it's directly related to obesity. Again, we have increased resistance in the body. You have increased girth around the waist. Again, obesity is genetics. It's also based on male and female. We deposit fat in different areas. We're all the same, but we're all different. Either we deposit it in the belly when we have girth around the waist, or it's going to be the outer thighs and the buttocks for women. That's where primarily they deposit. But again, men can deposit it in the buttocks and the thighs, as well as women in the belly. But based on genetics, those are the most common areas.
Yeah, so actually obesity also affects our sleep habits,
yes.
Right?
Yes. What we're referring to is what we call sleep apnea. Right. Sleep apnea is directly related to obesity, and that is related to the increased girth around the waist. What that girth does is it compresses the diaphragm. The diaphragm is an organ in the body. We need the diaphragm to help us breathe. The diaphragm travels up and down, and that's how we compress the lungs for gas exchange. So if we're not able to compress the lungs completely, we start to develop CO2. If we have carbon dioxide building up in the blood, what we call deoxygenated blood, that travels to the brain. We have receptors that are in the body that measures, we call them bariatric receptors, and they measure, and the chemoreceptors, the bariatric measures pressure, the chemoreceptors measure the CO2/O2 content. When the CO2 starts to build up, the brain kind of like shuts down, you become very sleepy.
Well, now I'm gotten quite nervous because I wanted to treat this thing, So what do? Do I run out there and start jogging real fast? Or what do you do when you can, as far as treatment is concerned?
Okay. Right, that's a good question. first and foremost, go to your doctor. You can come to me. You can ask Dr. Tamio. What we need to do is do a thorough history and physical, and then we do complete blood work to make sure there is no subclinical pathology such as hypothyroidism. Then we must treat that. Once we treat that, or if there is no subclinical pathology, then what we do is develop a protocol, diet, exercise, with proper nutrition.
Right. Then, of course, the treatment area brings in surgery, and that's really the last resort. But a lot of people have heard about staples, and I want to just quickly talk about that and whether that's successful, whether you have any experience in that area.
Okay. Well, we're talking about is bariatric / gastric bypass surgery. That is, again, of last resort after thorough history and physical, diet regimen, exercise. When all that's failed, then I send you to a specialist, a general surgeon who specializes in gastric bypass surgery or bariatric surgery, and they do surgical intervention to reduce the size of the surgery.
Okay, so...
excuse me, reduce the size of the stomach through surgery.
Okay, and that's what we've heard when they say staples, right? Okay, so one of the things about that is the success situation in it. And because when you hear that, people say, oh man, stapling my stomach.
Right.
And is that a permanent situation? And how many patients have you referred for that kind of treatment?
Okay, well, let's go over stomach stapling. That's an old procedure. You don't see that anymore. They do banding, or they actually do surgical intervention where they literally reduce the size of the pouch, the stomach itself. I have between 15 and 20 patients of mine that I referred out because they had morbid obesity, and on average, after 6 months, they've lost 75 pounds. I have one individual who lost 135 pounds within a year. So it does work, again, but it's a intervention of last resort.
Right, but it's a preparation too that person has to be, because that's a permanent state. Once they do that, they have to modify a lot of things. Am I correct?
That's correct. Yes, there's a whole protocol, a regimen that you must meet. You're going to see the psychiatrist. You're going to see a nutrition counselor. You're going to go through certain diagnostic testing, a complete history and physical. And once you're pre-op medically cleared, then you can have the surgery.
Okay, this is a flip question, but how much calories is in a pound of human fat?
Okay, fat, all right, and that's part of what we call adipose tissue.
Right.
For every pound of fat that we have on our body, it's 3,500 calories. So if you're 10 pounds overweight, 10 times 35, which is 35,000 extra calories in your body. If you're 100 pounds overweight, that's 350,000 extra calories that you're carrying on your body.
Well, I'm ready to drop some weight real quick, you know, and the first thing you want to know is, how do I just cut it? Do I cut it off? What did I do to get rid of it? Because we're talking about a lot of calories, okay? And what is this, how do you approach this, and what is considered, fat?
Right. Well, again, let's start off with a thorough history and physical. Like I've always say, and I stress this, be proactive. History and physical, routine blood works. Make sure there's no subclinical pathology involved. If all your tests come back negative, then we put you on diet modification, a diet regimen, exercise protocol, and a proper way to lose weight is between 1.5 to 2 pounds of weight loss per week.
Okay, well, we've covered obesity and for many different areas. I think we've pretty well given it to our audience a good understanding, and the Word of God says, above all, get an understanding, but it tells us seek knowledge. Now, you don't have to seek the knowledge because we have given it to you, but we want to allow you to go further in getting more knowledge about it. And we're going to tell you about our website in a little while, but before we go to that, there are some events that are coming up, because we want to be involved in the community. We just don't want you to know that you got to go to Dr. Tamio's office when you're sick, and we want to reach out beyond that and be involved in the activities, especially the family activities of you and our audience, and certainly we want to be part of that. So Dr. Tamio, tell us about the event that we're having on December the 11th.
Yes. Well, we have some special events coming up, and on December 11th, Church Alive Community Church, Ask Dr. Tamio, and the Skate Key are all famous Skate Key. Yes, famous Skate Key we are all co-sponsoring a on-site TV show. This TV show is going to be titled Physical Fitness Through Roller